Have you ever woken up in the morning and felt as if your body had aged several years after just one night of sleep? Your neck is so stiff you have to turn your whole body just to look to the side. Your lower back feels heavy, almost locked in place. Your shoulders ache with a dull, lingering pain. There's a mild headache that refuses to go away. And the most confusing part is, you still slept a full 7 or 8 hours. You didn't wake up. You didn't struggle with insomnia. Yet the moment you step out of bed, it feels as if you've just finished a full day of hard physical labor. Many people believe this is completely normal. They assume aging is simply collecting its debt. They blame the weather, their workload, the mattress, or the pillow. But the truth few people tell you is this. While you sleep, your body is still under pressure. If your sleeping posture is wrong, your spine can remain bent or misaligned for hours. Your neck muscles may stay strained and uneven all night long. Your hips and lower back can be placed in a subtle but continuous twist. There are no warning sounds, no immediate signs, only the next morning, when your body finally presents the bill. What makes this more dangerous is that these injuries don't happen in a single night. They build up little by little. Hundreds of nights spent sleeping incorrectly can leave you waking up increasingly tired, stiffer, and less flexible. But the good news is that you don't have to change your entire life to fix this. With just a few extremely simple adjustments in the way you sleep, you can start to feel the difference as soon as the very next morning. And we'll begin with a sleeping position that many people find the most comfortable. Yet it may be quietly placing significant pressure on your neck and back throughout the night. The position we're about to talk about is one of the most common, yet also one of the most misunderstood. Many people say, "I can only sleep well when I lie on my stomach." It creates a feeling of being fully embraced by the bed, a sense of safety and familiarity built over many years. But that very sense of comfort may be quietly causing your body to pay the price every single morning. Now imagine this. When you sleep on your stomach in order to breathe, you're forced to turn your head to one side, and you don't hold that position for just a few minutes. You keep it for 6, 7, sometimes even 8 hours. One side of your neck muscles is constantly stretched. The other side is compressed. Blood vessels, nerves, and the small joints in your neck are all subjected to an unnatural twisting angle. When you wake up, your neck no longer feels flexible. You try to turn your head and feel pain. You may think the problem is your pillow, but in reality, it's your sleeping posture. And it doesn't stop there. The heaviest part of your body, your abdomen and hips, sinks into the mattress. This creates excessive arching in the lower back. The spine is designed to maintain a natural curve, but when you sleep on your stomach, that curve becomes deeper than normal for hours at a time. It's similar to holding your back in the wrong position while lifting something heavy, except you're doing it in your sleep without even realizing it. There's also another factor most people never consider: breathing. When you lie on your stomach, your body weight presses down on your chest. Your lungs can't fully expand. Your breathing becomes more shallow. You may still be asleep, but your sleep is not truly restorative. This is why many people get enough hours of sleep yet still wake up feeling exhausted, heavy-headed, and low on energy. The good news is that you don't have to change everything overnight. Simply try to begin your sleep in a better position. Even if you unconsciously roll back onto your stomach after a few hours, getting the first 2 or 3 hours of sleep in a proper posture can significantly reduce the pressure on your neck and back. Over time, your body will relearn how to sleep more safely. And if sleeping on your stomach places so much strain on your body, then which position truly allows the spine to rest and helps you wake up feeling lighter and more refreshed? We'll explore that next as we talk about side sleeping. So if sleeping on your stomach puts constant pressure on your neck and back throughout the night, many people switch to side sleeping in the hope that things will improve. And it's true. Side sleeping can be one of the most natural and spine-friendly positions. but only if you do it correctly. Miss just one small detail, and you may still wake up feeling stiff, sore, and exhausted as before. The first golden point is right under your head. The pillow. If the pillow is too high, your head is pushed upward and your neck bends toward the ceiling. Your neck muscles must stay tense all night to keep your head stable. On the other hand, if the pillow is too low, your head drops toward the mattress and your neck bends in the opposite direction. Both situations can leave you waking up with neck pain and aching shoulders. The correct position is when your head stays aligned with your spine, like a natural extension of your body. An extremely simple trick is to fold a towel and place it under your pillow. Add another fold if you need more height, or remove one if it feels too high. You can fine-tune your pillow in just a few seconds. The second golden point is your waist, an area most people completely overlook. When you lie on your side, your shoulders and hips, being wider, touch the mattress first, while your waist sinks into the empty space in between. This leaves your lower back unsupported for hours. The next morning, your back may feel stiff and it can be hard to stand fully upright. Simply placing a thin pillow or a rolled towel under your waist fills that gap and restores the spine's natural straight line. It's a small change with a surprisingly powerful effect. The third golden point lies between your knees. When your top leg falls forward freely, its weight pulls your pelvis downward. Your lower back becomes slightly but continuously twisted. At the same time, your knees press against each other, creating discomfort. Placing a pillow between your knees keeps your legs parallel, balances your pelvis, and releases the twisting force on your lower back. If you often experience hip pain or outer thigh soreness, this one detail can make a noticeable difference from the very first night. And if you frequently deal with heartburn or acid reflux, try starting your sleep on your left side. This position makes it harder for stomach acid to flow upward because of the stomach's natural structure. But there is still another sleeping position that can reduce pressure on your lower back almost instantly, as long as you know one small trick that very few people are ever told. But there is still one position that many sleep experts consider the most neutral for the spine: sleeping on your back. When you lie on your back correctly, your body weight is distributed evenly. Your joints are not twisted, and your muscles finally have a real chance to relax. However, just like with any other position, one small mistake and the benefits can quickly turn into a source of pain. The first detail to pay attention to is the pillow under your head. If the pillow is too thick, your head is pushed forward and your chin almost touches your chest. Your neck falls into a posture very similar to when you spend hours looking down at your phone. The muscles at the back of your neck must work all night to prevent your head from bending even further. The result is waking up with stiffness and a dull ache that can spread into your shoulders. On the other hand, if the pillow is too thin, your head tilts too far backward. The natural curve of your neck becomes overstretched, creating discomfort at the base of the skull and the back of the head. The correct position is when the pillow gently supports the curve of your neck, keeps your face pointing straight up toward the ceiling, and maintains a natural alignment of the cervical spine. But here is the real golden trick that surprises many people the first time they try it. When you lie on your back with your legs fully extended, the muscles at the front of your thighs pull the pelvis downward and cause your lower back to arch away from the mattress. This gap creates pressure on the spine for hours. Simply placing a pillow or a rolled blanket under your knees can change everything almost instantly. Your knees bend slightly, your thigh muscles relax, and your pelvis rotates gently into a more neutral position. Your lower back settles closer to the surface of the bed, and the curve becomes natural rather than excessive. Many people describe this sensation as if someone just lifted a heavy load off their back. If you often experience shoulder pain when sleeping on your back, try placing a small pillow under your arm as well. When your arm is slightly elevated and supported in a comfortable position, the shoulder joint is no longer strained or pressed down into the mattress. And once you understand how to position your body correctly in each sleeping posture, the next step is to look at the small habits before turning off the lights. Simple details that can determine whether you wake up feeling refreshed or sore the next morning. And once you know how to position your body correctly in each sleeping posture, there is still one final factor that can make a surprisingly big difference: the small habits right before you close your eyes. This is the part many people overlook, even though just a few seconds of preparation can help you wake up feeling much lighter and more comfortable. Start with a simple 3-point check before turning off the lights. After you lie down, ask yourself, is my neck properly supported? Is my lower back sagging or slightly twisted? And are my knees positioned in a way that keeps my body balanced? It takes only about 3 seconds to scan these points, but this habit can prevent hours of accumulated tension during sleep. When you repeat it every night, your body gradually remembers the correct posture and the adjustments begin to feel automatic. If you often experience pain along the outer hip or thigh, there is a very simple yet highly effective trick. Before getting into bed, lie on your side on a firm surface and place a tennis ball under your glute muscle, slightly behind and above the hip joint. Move slowly to find the tight spot, then maintain gentle pressure for 30 to 60 seconds. Many people are surprised by how quickly a sense of relief appears. Just remember, target the muscle, not the bone, and reduce the pressure if you feel sharp pain. Next is an easy lower back stretch you can do in less than a minute. Lie on your back, pull both knees toward your chest, wrap your arms around them, and gently rock side to side for about 1 minute. This movement helps release muscle groups that have been under load all day. When practiced consistently for a week, you may notice that falling asleep becomes easier and mornings feel less stiff. Finally, avoid eating a heavy meal within 2 hours before bedtime. A full stomach makes every sleeping position less comfortable, prevents deep breathing, and increases the risk of acid reflux. If you found these tips helpful, press the subscribe button right now and turn on notifications so you don't miss the next videos. Share this video with family members or friends who wake up in pain every morning, because sleeping without pain is not a luxury. It's something you can absolutely regain.